I'm Dr. Foojan Zeine. I'm a psychotherapist, a licensed marriage and family therapist, speaker, and an author. I would like to tell you about a seminar, The Power of Two, that I'm doing with Behnan Marchandet, which is a wonderful coach and a relationship and a business coach. This seminar is about you in your relationship, the most important aspect of your life, your intimate relationship. In this seminar, you will get how you have been behaving, how you have been thinking, your belief system, and your behaviors within your intimate relationship that has created the result that you have gotten right now. And will give you a lot of tools, amazing keys in how to create a successful relationship and how to sustain and maintain it. I hope you enjoy it. Well, welcome back to Inner Voice Show. We're here with Szabo, founder and CEO of Human Power Project. So Ross, we're talking about bipolar disorder and the family members of someone who has been diagnosed with bipolar. Obviously, the family members also go through a lot. They don't feel what the person is feeling. However, they have their own feelings of anxiety, depression, disappointments, fear about the future, a lot of unknown, not necessarily knowing what to do. And what has your experience been since you were a family member of someone who had bipolar and you had your own family and then have talked to so many of the families around the nation about this?
Well, I think the hardest thing for family members is you don't know what to do. You really, when you see somebody start behaving the way they're behaving, or they go through these changes, or these things start happening, you really are in this place of, I just don't know what to do. And I think the most important thing to do first is to educate yourself. Whatever the diagnosis is, learn about it as much as you can. Read books, go online, talk to people, do as much as you can to learn about it. You would do that with cancer. You would do that with a heart problem. You would do that with any other health issue. Mental health is as important as physical health, so educate yourself first. The second thing I think that I saw and my family struggled with was, how do we talk to my brother about this? Usually when you want to talk to somebody about an emotional issue, it almost instantly turns into confrontation. You don't know me, leave me alone, I'm fine. And how can you find a way to turn that confrontation into conversation? And some of the ways to do that are to focus more on how they feel about having this issue than to fix the issue. I think a lot of times as family members, we see someone suffering, we're like, we need to change this, we need to help make this better. But sometimes in helping to make it better, as our first goal, we miss that the person's going through it. So talking to them about how they feel can help turn that confrontation into conversation. And then I think the most frustrating and difficult part of having a family member who has a mental health disorder is watching them spiral or watching them not be able to make the changes. You know, I remember when I went out to my 21st birthday, my parents started crying, and I said to them, well, why are you crying? And they said, you know, we didn't think you'd live to be 21. And how do you sleep at night when you're not sure your child or your loved one is gonna make it? And so in those times where you don't have a sense that they might get out of this or they might be okay, it's important to take care of yourself. It's important to talk about your emotions. It's important to talk about how it makes you feel and do things for your own mental health. Because typically in families especially, if one person's mental health goes downhill, everyone will go with them. Everyone will follow suit. So those are kind of the overviews I would give a family.
One of the issues that I've really know that the families have dealt with someone who has been diagnosed with bipolar is medical management of that. Many times we've seen if somebody has high levels of anxiety, they don't refuse medication. They really want medication to calm themselves down. Even if somebody has depression and they take the medication and they feel better, usually they will attempt to continue with the depression, with the
pills and go through the medical management, or many other illnesses, not only mental illnesses, but physical illnesses. If they know they have high cholesterol or they have diabetes and they need to take medication for the rest of their life or for a period of time, they are. One of the reasons with bipolar, it may be that they're going through the ups and downs and they take medication a bit and then they don't, have been found in some of the studies that because of the mania part or moving through the cycles, they feel so good that they figure, I don't need this, I'm okay, I just don't need to take the medication. And then they come off of the medication, and then this is where a lot of times the family members are also struggling to ask the person to kind of like hold the regimen of the medication in order for the cycles not to be as extreme as they are, or to maintain the cycle. I don't know, with your own experience or with people who you have spoken with, what your suggestions are about how to speak with a person who has bipolar, or if some of our audience are actually diagnosed with that, in what form of management they can have internally and with themselves about medical management and taking medication for their disease.
I think that, you know, some of the advice I always give is treat it like any other health issue. You know, when I speak in colleges, I always say, if your friend broke his or her leg, you'd want to know how it happened,
right,
how long they were going to be in a cast, what their therapy was, and what you could do to help them. When it's bipolar disorder, it can be very similar. You know, how does it feel to have this? How, you know, when did this start happening? What can I do to be there for you? What do you need from me? In the times where somebody is so manic that they're not making any sense and off their treatment or away from their treatment, those are the times where it's really hard to rationalize with anyone. You can't rationalize with irrationality. You know, you can't get someone to a place of like full understanding. So there are going to be times when you're experiencing bipolar disorder or dealing with someone who has bipolar disorder where they may not make sense and you may be really concerned about them. My advice in that situation is when they come back down or come back out of that, maybe have a conversation with him or her to discuss some ways that you could help them see it while they're in it, because they may not have those tools. And as a family member, it's always good to check in with somebody who does see you going down that path. It's always helpful for me to hear from friends who say like, well, you're not doing these things anymore, so why? And can we talk about it?
My own experience of the first time I've ever seen full-on mania was in a hospital, and this gentleman came in who was a comedian. And on the first time we were putting him on admission, he was talking to me and I was writing everything he was saying, and it didn't make sense. So about 5 days later, when he was coming down, he was telling me 8 jokes, but he was doing it so fast that only the punchlines of the jokes were coming out.
Oh, wow.
So a couple of days later, I got the whole full version of the 8 jokes, where at the first night I was getting punchlines of the jokes, which was never making sense, because that's how rapid the thought process was, that so fast he was thinking, and the amount of the speed that was going through his mind coming out and making words were off a bit. So all I was hearing were punchlines of the jokes. So that was my first time experiencing mania with someone.
Right.
Human project, power project.
Yes.
So how come? What happened? Why did you decided to create and create this sort of a company, and what do you do with Human Project?
Okay.
Human Power Project.
Yeah, so I ran the National Mental Health Awareness Campaign for 8 years, from 2002 to 2010. That campaign was started at the White House in 1999 by Tipper Gore, and it was started mainly to raise awareness for mental health issues. And so while I was at the organization, I spoke to over 1 million people, and I trained a ton of young advocates. I created the first youth mental health speakers bureau in the country. We created school programs, and we had PSAs that ran on MTV and, you know, major networks. And I think it was really great, and I think it was really useful. That raising that awareness is always going to be vital. I took a break in 2010 and joined the Peace Corps, and I served in Botswana for 2 years and 3 months. And when I came home, I went to see one of the speakers that I trained, and he was great, and he got a standing ovation, and everybody loved it. And then I said to myself, okay, but I was doing this in 2002. It was 2012 at the time. And so I was thinking to myself, well, what's next? We can raise all the awareness we want, but what's next? And I feel what's next is curriculum that actually gives people the tools they need to address their mental health. So we need these PSAs. We need people standing up and saying, seek help, talk about this, it's okay. But we also need to start implementing practical things that allow people to talk about mental health, to engage with it, and to learn tools to kind of address their lives. So my first wave of curriculum is called Behind Happy Faces, and it rolls out to 25,000 students this fall. And it has 4 lessons, and the lessons are why you think about mental health the way you do, just further exploring stigma in your own way. The second lesson is just learning a vocabulary to actually talk about mental health, because people of all ages constantly confuse stress with a breakup with depression. And they're not in the same categories. We need to find a vocabulary to balance our lives. The third lesson is on how to change ineffective coping mechanisms. And the fourth lesson is on how to help a friend who's in crisis, and a friend who's suicidal. The curriculum is for high school and college students, but I do have a corporate version as well that I'm working with a couple companies on right now, because the Affordable Care Act requires that employers pay for employees' mental health coverage.
Yes.
But there's very few programs educating employees on why they should seek help and how.
Especially when we're talking about teenagers. I think it's very, very valuable for teenagers to learn how to assess their own symptomology and what to do and what is the anxiety. Because I think that when we're a teenager, we automatically think we're weird anyway. Our body's changing, our hormones changing, or the chemical aspect of our body changes, our needs are changing, the way we are with parents are changing. So on a normal day, everything is changing. And then if we're also having some symptomology of early, whether it's early depression or early anxiety or early symptoms of bipolar, it's good to know, because when you become not only aware of yourself, but as you said, have some tools in how to manage your life when you're experiencing all of this newness that it's coming to your life, then you can take the newness and do something which is more effective for your life and be a support to each other, because teen years are really peer years.
Right.
So the way we are together, we either love each other or ridicule each other in a sense.
Right.
So knowing how all of these can be a support mechanism and a path to move forward, rather than just giving each other drugs, but rather giving each other support to move us toward other realm of how to handle anxiety and breakups and depressions and falling in love and breaking off of love, and our friends not wanting to be friends with us, or am I popular or not, or am I succeeding in my classes or not, am I dumb, am I excellent, where am I going, and the distinct difference between the different even cultures of the family and school. And because many of our audience right now are multicultural and multilingual group who are coming from different countries, and actually their family of origin is different, has a different culture than the peers that they're going to school with. And then this distinction between these family cultures brings more stress for them. So a curriculum that you are building and is being utilized in many of the schools, it is a jewel for people, for students to really learn about who they are, how to assess the symptoms, what to do with the symptomology of anxiety or depression or any of them, who to talk to, what to do. And it's an amazing path that you're taking.
Thank you. Thanks. I appreciate it. And I think the biggest goal is to normalize mental health rather than isolate mental illness. Because I think what's happening now is, through all this awareness of mental illness, there's almost a dichotomy of, I either have a mental illness and I need help, or I'm fine. But there is such a massive range of mental health challenges out there that we can't create this dichotomy, where you think the only reason you should talk about your emotions are because you have a mental illness. You should talk about your emotions no matter what you're going through. And then certainly if you have a mental illness, you should be able to talk about it and seek help. And so the curriculum is really aimed at normalizing mental health so that people understand where they are in terms of that mental health spectrum their whole life, where it's not just you either have the most extreme problem or you have nothing. It's just not that easy.
I like the way you're saying it, because when we're looking at the actual aspect of just regular health issues, right? Mm-hmm. We talk about exercise. We talk about changing our lifestyle to have an appropriate diet, regardless of whether we think we need a diet of being fat or gaining weight or losing weight. We want to be in a diet that works for us, in a diet and a style of living, of eating appropriate food, exercising appropriately, timely, sleeping habits of where you could sleep 7, 8 to 9 hours with appropriately when you need it in teenage years and then as a young adult. And when we're looking at a spectrum of life and looking at how we can do healthy living, we don't necessarily put the same concepts of utilizing tools for mental health. Mm-hmm. We don't look at how can I utilize skills daily in order to minimize anxieties that will pop up because of life issues. Mm-hmm. What do I do and what skills should I take mentally to look at aspects of my life where things might be disappointing to me and I don't get what I want and traumas of life might get me depressed, and how do I get myself out of depression? How do I get myself out of thinking a way that is not appropriate? Mm-hmm. And all of those are part of what we really need to learn as a child in school system, and our parents need to learn those in order to also mirror that to us. Do you also have courses for parents in the same realm at the schools?
We have information for parents, and we're developing kind of like a mental health resource guide for parents where it's learning the same things where the curriculum's adapted a little bit more to help parents. So it's on the way, for sure.
Great. So I would like everybody to go to www.humanpowerproject.com, and they can see some of more of your work, and he has some other clips on there that you can see his work and his speaking engagements. And thank you so much for coming and joining us. And hopefully as you implement more of the projects and you create some results, because I know that all of these are measured in a way.
Absolutely.
And then you can come back to our show and tell our audience about new measurements and new maybe curriculum that you've created.
Thanks so much.
Okay.
I appreciate it.
Thank you so much for being with us. And until another show, create a wonderful day.